Hi everyone, I'm back on the couch for episode 2 of my CEO video diary. And in this episode, the focus is on artificial intelligence, as a few weeks ago I was invited out to Stanford to take part in Stanford AI Week. They held a day on looking at responsible AI for safe and equitable healthcare. And I had the pleasure of having a fireside chat with their Dean of Medicine, Lloyd Minor.
My journey with AI really started in 2018, and ironically it started with Dr. Eric Topol, who is the Director of the Scripps Translational Research Institute, who was asked by our Secretary of State for Health and Social Care to help the NHS think about how it prepares for a future of technology. And one of the things that really struck me as part of that report and in his letter to the Secretary of State for Health and Social Care was this vision for a health and care system for the future that uses the convergence of technologies like artificial intelligence, genomics, wearable devices, the Internet of Things more widely, to help us move towards a health and care system which is more rational, fair, and tailored to the individual. There's a lot of work that happens around policy and strategy, which is really great to see. But turning that into action, really implementing that, is really difficult because the skill set sits over here. And actually what you need is to try and bring that skill set closer to those communities, closer to those regional healthcare systems. So we're working with Surrey Heartlands, which is in the southeast of England, a population of 1 million people. And actually it's a really nice place to do this because they have really good technological engagement. They have the highest usage of the NHS app in the country. And so it is a good place to do it. But I've been very clear with them that you need to understand where you're going to have the biggest success immediately. So in the next year or so, where is the evidence already, and where has some of the groundwork been done, and therefore what can you implement right away?
What do you think are going to be the biggest challenges of getting adoption, both by providers and by patients, and building the trust that the technology really does improve the quality of care and isn't a matter of spying or something that could lead to a number of the nefarious things that we've heard mentioned today?
Confidence is key to any of this, and that needs to come from healthcare professionals themselves, actually. We need to see how it's going to help us, and we need to see how it saves us time. And I think patients want to see that as well, because actually the messaging is, again, between the healthcare professional and the person that you're looking after. That's the most critical relationship in all of this. And this is something that came through in the Topol review, was the gift of time and maintaining that human relationship.
One of the advantages of being here at Stanford this week has been the opportunity to catch up with some people doing some incredible work. And I had the opportunity to have a conversation with Zainab Garbasani, who has done some incredible work on AI and health equity and used to work for NHS England. And she shares some of her reflections on how this work might impact us in the NHS.
So I've got a background in health policy. I used to work for NHS England in the Innovation Researchers and Life Sciences group, and I am now currently at Stanford leading an international interdisciplinary initiative all around community-centered AI and how do we make sure that AI advances health equity rather than making things worse. It's been incredible this week just seeing how many different stakeholders from different backgrounds and different expertise and experiences and sectors even can come together to be able to problem solve. And I think that's how we're really going to be able to make sure that AI is implemented in a responsible and equitable way. So the work that I'm doing here is a kind of a continuation from the work that I started back in the UK. I dedicated my master's thesis looking at whether people from different demographic backgrounds perceive AI differently and what we can do to try and get more diverse engagement with AI. And so the work I'm doing now is really understanding what the hopes and fears are from different community members, especially the most underserved and the most vulnerable communities, underrepresented communities. Understanding what their hopes and fears are when it comes to AI. So what are the opportunities for AI to really tackle some of the biggest healthcare problems within these communities, but also what are some of the barriers that will mean that these communities will be able to access AI properly. Once we understand that, then how do we bring together all of our different stakeholders, whether that's policy, academia, whether that's healthcare providers, industry, and also civil society, how do we bring them all together to then hear these hopes and fears and these perceptions and respond to them accordingly. So yeah, that's what I'm doing at the moment.
It was really great to catch up with Zainab out in Stanford, and that was amidst all the jet lag. So what we decided to do when back in the UK was to have a conversation over Teams, in particular to talk about Access AI, a framework that she has published with her team and her colleagues to look at how we advance health equity in artificial intelligence in health and care. And we caught up just to discuss what this means for the NHS and actually some areas of good practice that already occur when considering underserved communities in the NHS when it comes to innovation.
I think the really incredible thing about the Access AI framework is that it's quite universal in its application. So I think across the NHS, teams can use it, but also globally, and that's why we've really tried to make sure that this is as an international focus as possible. But some of the stuff that I think that other people can also go to if they are looking to know more about how to implement AI in an equitable way are looking at some best practice across the NHS that already exists. So for example, you've got the NHS Confederation that recently put out their 5 steps to tackling health inequality, which is also phenomenal. And I've taken a lot of learning from that, and it really centres communities at the heart of it. And they say that actually the clinicians are the ones supporting and enabling communities, but the communities are really leading a lot of these conversations. You can also look at the Core 20+5 strategy and a lot of the work that's coming out of that team and the health inequalities improvement team just generally, because what they're doing is they're actually listening to communities about some of their barriers and their challenges, but also some of the places where the communities really want help and they want support, and they are then investing in those areas. So they are actually giving resources and funding to some of these community-based organisations, and so the community-based organisations are then in a better equipped position to be able to lead some of this work as well, because let's be honest, they are in the best position to be able to communicate with their diverse range of audiences and their stakeholders, and to be able to make sure that anything that we do create at the centre is implementable at the end of the day as well. And then you've got some incredible programs such as the NHS Innovation Accelerator and also the NHS Clinical Entrepreneur Programme that are now actually supporting patients and community members to innovate and to implement their innovations, again, bringing in their lived experiences and making sure that innovation isn't just for those who are most privileged in society, but actually the door is open so that innovation can support everybody as well. So some really exciting stuff actually going on across the NHS in this space, which is very aligned with the Access AI kind of framework too.
And that's a wrap for episode 2 of my CEO video diary. Thank you for watching. Look forward to hearing any feedback from you. All of the content that we mentioned will be available in the description. And thank you to my communications team for the support in putting this episode together. Make sure you subscribe and look out for further episodes. Take care.